Hello, and thank you so much for taking the time to meet with me today, Congressman. I really appreciate it. I also want to thank you for the work you've already done on expanding access to preventive healthcare across California. It's something we feel directly on the clinical side.
Thank you, Jerome. I appreciate you being here. Hearing directly from nurses is incredibly valuable. You all see things at the ground level that we don't always get updates on. I'm glad we could make time for this.
Again, my name is Jerome Tadeo, and I'm a registered nurse here in California. I've worked in clinical practice for several years and have spent a lot of time precepting new nurses and helping them grow into the profession. The reason I asked for this meeting is to share what I'm seeing on the ground with vaccine preventable illnesses and to talk about how stronger, more consistent vaccine mandates can protect patients, reduce hospitalization costs, and support the nursing workforce. I do have a specific request which I'll share in a moment.
I appreciate the work you do. Workforce issues are something we hear a lot about. And you're right, preventable illnesses have huge financial and human costs. I'm interested to hear more about what you're seeing.
I'm glad you said that. I want to quickly share a patient story that I think captures why this matters. You know, a few months ago, we cared for a man in his 60s from the San Gabriel Valley. He came in with severe complications from the flu. What stood out wasn't just how sick he was, it was his condition could have been prevented. He wasn't vaccinated because he'd heard conflicting information and felt uncertain. His illness progressed so quickly that he ended up intubated, and his daughter stayed with him bedside for days, terrified. As nurses, we did everything we could. But we all knew his suffering was avoidable. Watching that family go through something preventable left a lasting impact on me and the entire care team.
That sounds heartbreaking, and it must have been really hard to go through. Stories like that really highlight the human side of these policy decisions. We hear about statistics all the time, but hearing about a real family going through something preventable is different. It really underscores the importance of clear public health messaging.
You know, in nursing, we're trained to look at the long-term impact of policies on real people. Stronger vaccine mandates consistently show three main benefits: better patient safety, protection for vulnerable communities, and a more stable workforce. From what I'm seeing firsthand, consistent mandates across healthcare settings would make a noticeable difference. Nurses want to provide safe care, but without strong policies, we end up constantly playing catch up.
I hear what you're saying, and the workforce angle is something I don't think the public talks about enough. When outbreaks hit, it's not just patients who get sick. Hospitals struggle to staff units safely. That ripple effect impacts entire communities. Your perspective is really helpful.
With everything considered, I'm asking that you support and help champion legislation that strengthens the statewide vaccination requirements in healthcare settings, which include the flu, COVID-19, and other core vaccines, with a clear enforcement and support for facilities that need resources to comply. Stronger policy guidance at the state level would reduce variation from facility to facility and help protect both patients and staff.
I appreciate you bringing this forward. I support vaccines, but I do hear concerns from constituents about personal choice. How would you address that?
You know, that's a great question. Within healthcare settings, we look at vaccination less as a personal preference and more as a safety measure. Similar to like your hand hygiene or wearing PPE, we're protecting people who can't protect themselves. Consistent mandates give nurses a clear framework and ensure everyone meets the same standard of safety. Most patients assume that caring for them are doing everything possible to reduce risk, and vaccination is a key part of that. I brought a short one-page summary of the data and the main points we talked about today. I'd be happy to send more additional statistics or connect with you with nursing organizations that support this kind of legislation. Thank you again for your time and for listening to what we're seeing today. I really appreciate your commitment to keeping California communities healthy, and I'll follow up with your staff next week with those materials.
Thank you, Jerome. I really appreciate you coming in and sharing your experience. Hearing directly from nurses makes a huge difference when we look at policy. Please do send those materials over. I'd like my staff to review them. And thank you for everything you and your colleagues do for our community.